it puts things in perspective. And I feel like scientists, when they understand that there's like a much bigger purpose and you see the bigger picture, it's not you on the bench, you looking through a microscope, is not where it ends.
Welcome to the CureGRN podcast. We exist to bring together families, doctors, and researchers to work together towards a cure. And now on with the show.
Hey everyone, welcome to today's video on frontotemporal dementia, FTD, building awareness and networks for the future. I'm Matt Kjar, and I'm delighted to moderate this conversation. As many of you know, GRN is one of the genetic causes of FTD, contributing to dementia in individuals typically between the ages of 40 and 84. Increased awareness, early diagnosis, and strong community support are essential for families navigating this difficult journey. Today, we're honored to be joined by Dr. Swetha Mohan. Dr. Mohan has a PhD in molecular biology and biochemistry. Her postdoc at UCSF Memory and Aging Center, Department of Neurology, was focused on molecular mechanisms of FTD, particularly looking at progranulin. Her 2021 paper, Processing of Progranulins into Granulins, involved multiple lysosomal proteases, is frequently cited as a subject matter expert in neurodegeneration, molecular neuroscience, and cell biology, and lysosomal biology. Let's start from the beginning. Dr. Mohan, you trained as a molecular neuroscientist at UCSF. What inspired you to expand your work into building FTD-focused infrastructure in India? And how did that move from bench scientist into science advocacy work?
Thank you, Matt. Thank you so much for having me. And I'd love to thank CureGRN for having this space for families to come together and for access to information. As you mentioned, I worked as a bench scientist. I'm trained molecular biologist looking at diseases. I started out focusing on progranulin biology and understanding how progranulin functions in health and disease, alongside understanding what happens through research, which leads to therapies. The way that research is accessible to families is through systems that are built around research. A lot of developed countries already have such systems in place, such as registries and biobanks and family networks that help each other. These have been formed by pioneers in the field who understand the larger concept. It is looking at these systems that were built around research and understanding the powerful impact they have on each other is what inspired me to work towards building such infrastructure in places like India. So my introduction to India came also through a family network. They commissioned me to do a landscape study of frontotemporal dementia in India, specifically looking at progranulin mutation and what the clinical trial readiness is in India. And that work introduced me to amazing clinicians here. The quality of the clinicians and the diagnosis is just as in par as anywhere else in the world. But it also showed me how scale as well as bandwidth plays a role in ecosystems such as in India. Even though that there are very, very well-trained clinicians in India, they lack the bandwidth and the resources to set up these systems around research as well as around their clinics to be able to help families outside clinic.
Yeah, I think that's really interesting, because when you think about the systems that are already in place in other areas, it's taken a lot of time and effort and energy to get to that area, to get to that place. And advocacy, which is what CureGRN is, right? Advocacy in other countries may be just beginning. The clinicians are there, it sounds like, but the advocacy work is just beginning. Is that correct?
Yeah, and you would see that there is advocacy in a lot more in like Alzheimer's disease, which is much more well-studied and prevalent, but not so much in frontotemporal dementia, where the behavioral issues are a lot stronger and the caregiver burden is actually much higher in frontotemporal dementia. So I think building support groups around FTD is much more important to provide that support. And in India, if you see the clinicians can only do so much. You can think of what their bandwidth is like when it comes to setting up outside of clinic. That being said, there is still a lot being done because there are neuropsychologists on the team. There are other support networks in certain institutes that provide this, but there isn't anything in the national level. There isn't anything in other institutes which also see FTD patients, but maybe is not as well funded or has all these resources to support. And so it's been my passion for the past 2 years is to bring these clinicians together and find ways to reach families directly so as to set up a network that the families that can take and run with, just as CureGRN did and CureMAPT has done. And I think they've contributed a lot more to research when they come together as families.
There's such a wealth of access to people. When you think about different areas of the world and the knowledge that we can gain from one another. Talk to me about the access, the possibilities that are within India.
So I guess what you're asking about is access to path to clinic, right? So India is unique in that way where path to clinic is quite different across the country. But majority of these clinics are in the metropolitan areas, and they are usually associated with a large hospital or an institute on its own. There are private clinics, but not accessible to everyone in the demographic. So, and path to clinics looks different within each of these institutes. But once they reach the right person, they actually come back for care. It's quite different. The socioeconomic spread in India is quite large. So you can imagine that the access that someone who is well educated and has the access to go to a private clinic does not have, for a person who's coming from a village does not have the same access. However, somehow they both end up in these neurology clinics. I think that is the access to information is a much bigger question, which is and harder to solve at this stage. So my goal is more to build these infrastructures that can reach the patients that walk into these clinic and have a diagnosis first.
Yeah, that's really powerful. Thinking about that, what is there already a designed path? And if not, I'm just curious what kind of path we might be able to design. What path to reach the people that are in this specific group. Is there already a design path, or is that something that you're in the process of designing?
Thank you. That's a great question. We in India at this point, I have tried to coordinate within this cognitive neurology network, and through them have access to the patients. So there would be cognitive neurologists seeing folks in a government hospital, and there are cognitive neurologists that see people in a private hospital. When families reach these clinicians who I've already contacted they would then give them the opportunity to be part of this network. I should tell you so that it is actually nothing set in place yet. I am talking to all these clinicians, and I've written a grant to form this network and have and form resources that I can share with families. So we're at this stage. I have spoken with clinicians. We're trying to come together to form a consortium. We're trying to come together to start a registry, but that's at the institute level, right? The institutes come together to form these things. But in a separate effort is trying to reach these families directly through these clinics. So the idea is for when these families come and get a diagnosis, they would be offered a simple QR code for them to join a network group. So a QR code that'll allow them to like say, I want to be part of this WhatsApp community network that I can then use to give them resources that would be useful for them beyond the diagnosis. So it's a very small 1-year pilot grant that I'm trying to get funded, but so there actually isn't anything in place yet. So I've spoken to clinicians, and each of them seem to have a different path. But everyone lands up at the clinic irrespective, right? So I think it's a lower hanging fruit at this stage to try to access families that way. I think it's a much harder path to build awareness so that families can understand that this could be a neurological disease and then bring them to the clinic. So that's a larger task.
Talk to me a little bit about the importance of India and the importance of this work inside of India, because I think sometimes clinicians are very focused on their area, and I think there's a lot of information, a lot of potential there that maybe is untapped right now.
One of the main reasons to build this now is because there are several experimental therapeutics in clinical trials right now, specifically for GRN. And I can see that the bottleneck would be to find more families that are GRN positive that can enroll in therapies. So we have to work faster to identify families across the globe. So these infrastructures that have been already set up in the US, in Canada, in Europe, were extremely important to identify families. However, with a large population like India and a rare disease like GRN mutation, you would still find considerable amount of families in India who could potentially participate in trials and be part of this global network. To me, it's just a lot more of a passion project than like, having worked on the bench, this is helping me. No, I think trying to bring families together is going to make a much bigger difference. For me, it's like coming full circle, because I worked on progranulin as a researcher, and I worked with family, patient cells. And at that stage, you have this barrier between what you're doing in the lab and these families. And then once I've come out of the lab, and now I've just been interacting with families for the past 2 years. So to me, to try and find ways to take what I used to do and actually bring it to the families, it seems like a natural path for me right now. So technically my background in progranulin, it's just my interest in progranulin and my interest in frontotemporal dementia that has pushed me to try and work harder to set up infrastructure in India. And it's also, I totally see the importance of having something like this with what CureGRN is doing and what they are doing for families that are part of this network, and the power that kind of network in a community like this in India can do. I think it'll be very powerful, and one of the most important things is all the clinicians that I speak with are very, very interested in trying to help their patients. They want to try and find ways to move forward, trying to find ways to bring therapies.
Why it's such a passion project for you. I can tell as you talk about this how passionate and how excited you got about it. And it doesn't stem from the work that you did in the labs. And so talk to me about where that comes from.
As a person, I find I loved working on the bench. I love doing research, but having spoken with families that are living with FTD, I have found a lot more purpose with the work that I've done. I think it's given me a lot of validation on what I used to work on. I want to try to find other ways to help families, irrespective. So it's just for me, I'm thinking about it more in a global sense, not just in India. I'm trying to help India form these infrastructures because I now spend time here, but I think of it more of a global scale. So how can I take all this training that I've had and help families? So I have found that if they need help at trying to understand science, trying to understand what the latest trial data means, what does it mean to them, is very different from what the company puts out as their like top line result, right? So how do you interpret this? How do you navigate through this chaos of research and all the jargon that there is with research? So I think on top of having a diagnosis like FTD, the families have to now, without any scientific background, understand disease. So I'd like to be that conduit to help them. And I'm doing this in India only because I'm here and I see these clinicians and I see them unable to do what they want to do because of the sheer volume of patients that they have to see. They just don't have the bandwidth or the time. Not that they don't have the inclination to do it. Right?
This is a global problem, right? FTD it's not isolated to specific countries. And so recognizing the global nature and finding a global solution. I'm curious, as you think about this, how can we recognize the resources that are within India, within other countries, and kind of grow them together?
When it comes to bringing in countries like India, literacy and language issues are a big barrier. With the structure I'm trying to build in India currently, we're trying to make it more accessible by having having resources in regional languages. Also, because of literacy issues, we're also having more of audio for them to listen to rather than have a PDF handout for them to read. So I think that if we were to do this more globally, I think having families that can share resources, where there is maybe an organization that can help translate and distribute globally would be a great way to start. So for example, in India, there is no institutional care. Everyone is being cared for at home, and it's a very family-oriented, joint family setting. So a lot of the care, the burden falls on the women in the family, right? And how do they navigate that? How do they navigate in this kind of how do you talk about it with other family members? So I think even though all these resources exist, I think being very careful and adapting it to each country and each society will also need to be considered.
These people get the diagnosis. They suddenly are told, okay, you have FTD, and so the knowledge that they have, it may be minuscule compared to the knowledge that a clinician has or that an expert has. How do we make it simpler for people to access the knowledge?
Yeah, I think that would be very different in each countries as well. Actually, this is exactly my first goal to try and help at. So where I'd like to call it like the Day of Diagnosis Toolkit. And this is the project we're trying to get funded, where on the day of diagnosis, the families receive, once they have, so they go through, they get their diagnosis and they have a neuropsychiatrist who explains what all this means and try to help them understand what to expect, as well as how to care for the families at home. However, once they leave the clinic, they just leave with this slew of information, right? So to close the gap just on the day of diagnosis is the main goal, where beyond leaving the clinic, they still have access to some resources that like little very, very simple cheat sheets for them to go through, to be part of a network where they can then ask questions that we would pass on to the clinicians. And this set of toolkit will be curated for families so that they leave with less of a burden. on the day of diagnosis. So I think that's what I'm trying to achieve in the near future. It's a very stressful time, and it's a very stressful day or week for them. For me, sometimes I would think that I would forget everything that I was just told the moment I'm on the car back home. Right? Like, what was that? What did they say about this? Now I don't remember. Right? So to help with that, we're trying to create a toolkit that they can refer to and go back to the day after, go back to 2 days later, go back to a week later, that will give them the information that they will need for the first few weeks.
How would you disseminate this information globally?
So at least in countries like India, so let's take like all low and middle income countries, not everyone have access to computers. Not everyone have access to, they may have access to internet through smartphones, but they rarely browse. They're not going to like try to find what these symptoms mean. This is just not in their wheelhouse, right? However, in India, you have everybody uses QR codes for payments. Everybody. In India, you would find a street vendor who is pulling greens on the street, like on a cart, have a little QR code that allows for him and other people to use to pay him. So everyone who has, so I think in that way, India is digitally ready in that sense. So if we can lock into that system and provide information that way, whether it's audio or something to read, I think that is going to be the game changer. Because these kind of websites that exist in the US are there in India. So you have this large dementia website, but it is so filled with information, it is hard to navigate. Right. So let's think of like families that have this diagnosis, or are even thinking about like, maybe I need to think what these symptoms mean, and they land up on this website. It is hard for them to navigate through anything. So the best way to give them information is to give less information, but easily accessible information. So I think that trying to identify the tools such as this that these communities are already using in a large scale, and try and use that to give information would probably be the most successful, in my opinion. But this project will tell us. Especially in India, and I would think in a lot of low and middle income countries, people travel from very far to get access. As I talked about with the Path to Clinic, a lot of these main centers where these neurologists sit are in the metropolitan cities. So if there is this like one main center in the eastern part of India, so most people who live in the eastern states would go there because that is their main neurology center. So, having traveled all the way, and then they have a diagnosis, and then they have to travel back, they don't have access to call their clinician the day after and ask doubts, right? So they're going to need something to have on hand.
What are some of the positive aspects that you've seen in India that we can learn from?
There are other support work that's happening in India, not in FTD, but I met this one person. So this is another story where in the 2 years that I was trying to like understand India's network and what exists, how does it work, I spent some time trying to understand that. And I met folks from this organization called ORDI. They're called Organization of Rare Diseases in India. And it was started by a dad whose daughter had Pompe's disease. So this is a network, and it started off with like one family, and now it's become a huge network of all rare diseases, and they provide support. They were able to have regulatory changes made, and like policy levels changes made, and just like how global organizations like CureMAP-T and CureGRN are coming together and trying to help with like policy and regulation and therapies coming out. There are organizations that have achieved this in India. So it's not like, this is so new. We have to, and they are very happy to share their experience and how they've come about to where they are at now. So I think just to see the impact that families can bring together is, I think, a common story across the globe, whether it's in low middle income country like India versus Canada and the US or Europe. I think when families come together, their goal is so much more concrete. They're so much more focused. The clinicians really want to help. And if there exists an organization outside of their time that can help them build this infrastructure, I think it'll be very easy to then network with the clinicians, and then their burden is less, and then this infrastructure already exists for the families. These clinicians that I'm working with, they don't only see FTD patients either. So they are cognitive neurologists, and a lot of their patients, they see dementia patients across the board. So even so for them to focus on FTD also has to be an effort that they have to come together and make, right? So it's a secondary barrier.
You've spent much of your scientific career studying progranulin. Why is GRN such an important gene in the FTD field?
GRN is a pioneer in the FTD field at this stage. It is the first ever phase 3 clinical trial for FTD was conducted for GRN. The mechanism of GRN is also such that replacing GRN is a great place to start to find therapies for FTD. So identifying GRN families globally should be high priority for these trials. We are learning so much about GRN biology through these trials. Most of these trials are now conducted in a few countries where the systems around clinics exist, and they're able to identify families. But we have to now start looking outside of these countries.
Explain to me why it's so important that we start accessing more GRN families.
There is only so many families that exist that we know right now, and most of them have either chosen to enroll in a trial or not. So as new trials come, and every trial has different phases of these trials, phases within the trials, so we'll have to enroll more family members into these trials.
It's almost like a numbers game, it sounds.
It becomes a numbers game, yeah. So, and then beyond just, there are studies that happen for these experimental drugs. So that's one thing, right? But there's also studies that happen to understand biomarkers. There are studies that just observational studies, like these registries like ALL-FTD and GenFI that exist. The more people that enroll into these studies, higher chance of success is how I would put it. Yeah. And more, because more families would like to volunteer. And then in India, another big issue is genetic testing. So that's the next step, is to encourage folks to get tested, because there are no therapies, and because genetic testing is actually expensive in India right now. So it's all out of pocket. It is not accessible to most people here. They won't even suggest genetic testing. Yeah. So I'm actually working with some neuropsychologists now, trying to talk to families and connect them to folks like Wanda, and then have Wanda and her group of families talk about how genetic testing helped them. And then have them just sort of like a lived experience focus group that they can speak to these family members, and then we'll see what the response is. So I'm also trying to do efforts in that way to bring more awareness to the families directly.
It sounds like this whole experience has kind of brought your paper, your postdoctoral work, all of that kind of full circle, to the point where now what you're doing is yes, the knowledge, the study, the education was very vital, and now it sounds like it's really, you're seeing the impact that education has.
Yeah. Yeah. And what else can I do with it, right? Like, how do I now help the families not being on the bench? Like, how do I help them with the knowledge that I've already gained? How do I help them understand this better? So I'm trying to focus more on those aspects, and I find it a lot more fulfilling to work in this space.
As we wrap up, what message would you share with young researchers who want to make a difference in FTD or neurodegeneration?
To have to open up and see that there's so much more that what you do in the bench means to a family, compared to like, I'm going to do this today and then this tomorrow, is kind of what most PhD students or postdocs are thinking about as their project. And what is the answer to what is my hypothesis and how am I going to test my hypothesis? But the final impact of all of what we do on the bench is actually what happens to the families. And to me, that sense sort of came around when the GRN clinical trials were announced. And I started interacting with families that have, with Wanda actually. And to see that impact of like, oh my God, families that have this particular mutation. I'm meeting families with the mutation that I worked with on the bench, right? So it puts things in perspective, and I feel like scientists, when they understand that there's like a much bigger purpose and you see the bigger picture, it's not you on the bench, you looking through a microscope is not where it ends.
Thank you, Dr. Mohan, for sharing your insights and your passion with us today. Your leadership is paving the way for stronger FTD communities. And if you'd like to learn more about Dr. Mohan's work, you can take a look at the description below, and we will have a link to some of the ways to contact and to work with her. Thank you so much for your time today.